Dr. Ken Landau. Thanks for watching. Let's talk about the coronaviruses. Now, they're in the news a lot lately, but we've identified them several decades ago. The term corona has to do with the studying of the surface of the virus with the areas that actually are important for the virus binding to cells. Well, up until recently, human coronaviruses were considered an inconsequential pathogen. They made up about 10 to 20 or even 30% of upper respiratory infections. They were the common cold that affected otherwise healthy children and adults, passed on by droplets, sneezing and coughing, just like the influenza. Sometimes they affected newborns. Then they could cause a severe gastrointestinal problem, and they could make up about 3% of community-acquired pneumonia, pneumonia that might be relatively insignificant and certainly rarely would lead to hospitalization. Well, the question is, how is it spread? It's spread from person to person. But in the people who spread the virus, they already know they have it. They're not asymptomatic. But then beginning about 20 years ago, we've had several new viruses in the family. And these new viruses are much more highly pathogenic. They're from animal reservoirs. They seem to cause global problems of varying degrees, and they seem to increase the level of sickness and even fatalities. So what are these viruses? Well, there's the SARS virus, SARS coronavirus. That's the severe acute respiratory syndrome, and the MERS coronavirus. That's the Middle East respiratory syndrome. Then we have the 2019 novel coronavirus. So its story began in 2002. That was the SARS. Caused a severe atypical pneumonia. Seemed to be centered in Guangdong province in China. Ultimately affected just slightly less than 30 countries. Early on, it seemed like cases centered around a live animal market seemed to go from animal to human, later on from human to human. Seemed the original culprits were the masked palm civet or the raccoon dog, but they were the intermediary hosts. The real culprit was probably bat feces. So it was the horseshoe bat that's prevalent in Southeast Asia and China that seemed to be the natural reservoir. Originally, it was exposure in those markets. Subsequently, most of the cases have nothing to do with exposure to the market. It seems that the bat itself contains lots of different kinds of viruses, lots of coronaviruses. And sometimes these viruses break down and one particle meets with another particle and they recombine. And sometimes there are mutations inside the bat. And it seems that over a period of time that those spikes that we talked about a moment ago, they became able to attach to part of the human cell. And it attached to what we call the ACE2 receptor. Symptoms, well, symptoms were kind of typical for severe pneumonias, a fever and a cough and shortness of breath that led to pneumonia. But then about 10 to 20% of the people with SARS had watery diarrhea. Many of them had sore throat and myalgias and muscle aches and headache. Maybe up to 20 or 30% of the people who were diagnosed with the condition required mechanical ventilation. Originally, it was thought that it was just emerging flu epidemic. After all, Guangdong is where the avian flu started. So the cases were noted, and they were noted in Hong Kong then, and they were noted in Toronto. And overall, it's thought that there were probably slightly more than 8,000 cases, somewhere around 775 deaths reported from the condition. The fatality rate was about 10%. Seemed like it attacked and caused more problems in people who were older, people who had other kinds of medical disease. And in spite of all of the talk about SARS, there were only 8 laboratory diagnosed cases here in the United States and 19 other probable cases. Well, it seemed that the virus came to attack humans when that spike or the corona was able to attach to certain kind of receptors, the ACE2 receptor. And the ACE2 receptor is in the lower respiratory tract, not the upper respiratory tract, but the lower respiratory tract. It also happens to be on some of the cells lining the blood vessels. Well, international spread outside of China started in Hong Kong in the Hotel Metropole, and then it spread from there to the rest of the world. And it was thought by the World Health Organization that almost everybody outside of China who became infected with SARS and who died because of SARS traced to one individual who happened to be a respiratory doctor who was in room 911 of the Hotel Metropole. Well, transmission, it's not just random transmission. It seems like about 40% of people with SARS were family members of other people who were infected, and about 20% of the people were hospital workers taking care of people who had the SARS. Well, there's a story about human super spreaders, and that individual in the Hotel Metropole was a human super spreader and was able to spread it. And with many diseases, it's just a few people who spread most of the disease. The overwhelming majority of people who are sick don't spread the disease, but it's just a few people seem to spread the virus to multiple other people. Well, the disease died out after about 9 months on its own. We didn't have any treatment, we didn't have any vaccine, and the virus just went away. And then in 2015, we had another one in the same family, and it was called MERS, another beta coronavirus. It was first identified in the sputum of a man in Saudi Arabia who died from respiratory and kidney failure about 11 days after he went to the hospital. Next case was another person from the Middle East who happened to be in London. Well, then, unlike with the SARS epidemic that had rapid global spread and then rapid containment and disappearance, MERS seems to be a smoldering disease. It seems to sporadically go from animals to humans. In this case, it was a camel to humans. There was originally limited human-human spread, and still we have some human-to-human spread, but it's not really dramatic. Most of the cases are in Saudi Arabia. It seemed again that bats were the natural reservoir. Bats spread the virus to dromedary camels. They were the intermediate host. But we've known that camels have been infected since at least 1983. And by 2003, more than 90% of camels were seropositive for coronavirus. Person to person, yeah, it happens. But most of the people who are infected from person-to-person contagion with this particular virus happen to be hospital workers. There was a cluster of 23 people in 3 different hospitals in Saudi Arabia. So we have one patient, actually, who was transferred to a lung hospital in Germany. Actually was there for about a month before they figured out what was wrong with him. And during that time period, didn't affect anyone. So, like SARS, MERS is a severe atypical pneumonia, oftentimes requires mechanical ventilation. Does that 50 to 90% of the time. Respiratory failure comes on after about 10 to 12 days after the illness began. Sometimes people produce a lot of sputum, have difficulty swallowing, have muscle aches, have more prominent gastrointestinal symptoms, and they often develop acute kidney failure. Now, some of the people, as with SARS, are asymptomatic. And we think that the number of people who are asymptomatic is probably quite significant. Maybe as many as 80% of the people don't have any kind of symptoms. Others have just a little mild flu-like illness. And a few of them have severe respiratory distress. Seems to be a different receptor is involved. Instead of the ACE2 receptor, we call this one the DPP4 receptor. And it happens to be, again, in the lower airways in the lungs, not in the upper airways. So it doesn't cause a typical upper respiratory infection. Also happens to be in the gut and the kidneys. So through the end of 2019, this virus, the MERS virus, has affected fewer than 2,500 individuals, caused about 850 deaths for a mortality rate of about 35% of the known cases. But since a lot of cases weren't ever diagnosed, the mortality rate is somewhat less than 35%. If you are very ill and if you're admitted to the intensive care unit, well, then there's probably a greater than 50% chance you'll succumb to the particular virus if you happen to be in Saudi. On the other hand, in cases where the virus was diagnosed in South Korea, the fatality rate was less than 20%, or just about 20%. So most of the people who have this virus, 80% of them are in Saudi, and significant number in 12 other Middle Eastern countries. The only area outside that had any significant number was in South Korea, obviously due to travel. The South Korea outbreak, again, brought up the whole concept of the super spreader. There was one person in a hospital in Seoul, and he infected 82 people in the emergency room over a 3-day period, 33 patients, 8 healthcare workers, and 41 visitors. And there were a significant number of other people who were exposed during that same time period, over 1,500. They did not become ill. So from that, we get the incubation period of about 5 to 11 days. MERS seems to be worse, just like the SARS, if a person has some other kind of underlying abnormality, diabetes, hypertension, renal disease, cancer. They have a more severe illness than the people with SARS, higher case fatality rate, time from onset to death anywhere between 11 and 27 days. And again, it's not just casual spread. So when we look at people who are infected, more than 45% seem to be in the hospital. Those are the hospital workers, the nurses, the other patients. Family members, somewhere between 10 and 20%. Asymptomatic transmission doesn't really seem to be an issue. Well, in 2017, because of these two different viruses, the World Health Organization placed both SARS coronavirus and MERS coronavirus on priority pathogen list, meaning let's stimulate some research. But in 2019, in the spring, quite prophetically, Chinese researchers wrote that they believe bats harbor a significant number of other coronaviruses that are going to emerge, and China is likely to be a hotspot. And then several months later, first case in Wuhan City, in the province of Hubei. December 1 to December 8, first cases started to be reported seeming with exposure to a seafood market. And it seemed that live animals somehow were involved in this spread. So all of the confirmed cases originally came from the Jinyintan Hospital. That's an infectious disease hospital that specializes in people who are over age 14. That's part of the reason why we don't see any children who are recorded as having the disease, partly because they're excluded from care in the hospital. Well, of the original 100 patients, 50 of them, so about 50%, seem to have exposure to the seafood market. Most of the people worked there, a couple of the people just shopped there. Most of the people were men, average age about 55 or thereabout. Typically, they had significant other medical issues, cardiovascular, cerebrovascular, diabetes, or chronic obstructive lung disease, or cancer, something of that nature. Well, what were the symptoms? Symptoms were the same that we're talking about with the other viruses. So the people presented quite similarly to SARS. They presented with the fever, cough, productive of sputum for the most part. They had shortness of breath, seemed to come on about 8 days after the infection began. Significant number of them had muscle aches and headaches and confusion. Some had a sore throat, runny nose, and a very few chest pain. Some people developed diarrhea, but only about 2% versus about 25% with MERS, some with the SARS. Nausea, vomiting, only about 1%. Some of the people, even though the receptor seems to be in the lung, some of the people did develop some runny nose and sneezing and sore throat. Diagnosis on chest x-ray. Well, it was quite obvious that people had pneumonia. It looked like bacterial, or viral pneumonia rather. It looked like viral pneumonia. So they excluded the SARS and the MERS. They excluded some of the other kind of common viral and bacterial elements. And then, unfortunately, the fatalities started to build up. The first person who died worked at that live seafood market. He'd been hospitalized for 7 days with fever and cough and shortness of breath. Actually, his wife also was infected. She didn't die. So the death rate initially was somewhere between 11 and 15%. About a third of the patients were admitted to the intensive care unit. That's of patients overall who were diagnosed and put in the hospital. If we look at the total number of patients, then the death rate is considerably smaller. Only about 20% of the people develop severe illness and pneumonia and respiratory failure. Asymptomatic mild infections, so the asymptomatic or mild infections, they regularly occur. The frequency is unknown, but it seems that a significant number of people are infected who don't even know or have mild complaints. And that actually accounts for about 82% of the people who have this 2019 novel coronavirus. They're asymptomatic or mildly symptomatic. Only 15% have severe condition. About 3% have critical condition. The death rate, when you add up all of the people, the asymptomatic and the symptomatic, is less than 2%. Hardest hit people seem to be the doctors and the nurses working in the hospital. Closest contact seem to be other people in line waiting to get into the hospital. It seems that the Centers for Disease Control tells us that the incubation period can be as short as 2 days to as long as 14 days. That's why you hear this, you got to wait 14 days. That's the maximum extent. Most people much less. The duration of the illness is about 10 days. Seems to be more infectious than SARS, but less severe overall. From the onset of symptoms to hospitalization, it's about 7 days, range between 2 and 8 days. The onset of symptoms to the development of shortness of breath going to be about 8 days. The onset of symptoms to mechanical ventilation, about 11 days. Same to the requirement for intensive care. If we do a chest x-ray or CAT scan, looks like a bilateral pneumonia, viral pneumonia in type. Do some laboratory tests, find the platelet count is low, find the lymphocyte count is low, find some inflammation or irritation of the liver. The liver tests are elevated, but interestingly, so too are the heart tests. So if we were to do a blood test, same kind of blood test we would do to see if you had a heart attack, well, it's elevated in about 10% of the people with this 2019 novel coronavirus. How do we make the diagnosis for sure? Well, there are a variety of tests that are now available thanks to sequencing of the gene and several other subsequent activities that researchers provided with. So we now can make the diagnosis. The first case in the United States, a Chinese man who traveled from Wuhan back to Chicago. In spite of all of the talk about this virus, as of February 10, 2020, of course, there are only 12 cases that have been reported in the United States. 6 of them in California, 2 of them in Illinois, 1 of them in Arizona, Washington State, Wisconsin, and another in Massachusetts. So of all of the tests that have been performed here in the United States, only 12 came back positive. 225 tests ordered through the Centers for Disease Control were negative, were pending results on another 100 of the tests. So the full genomic sequence was published from researchers at the Shanghai Public Health Center. They published them but didn't share the virus itself. Supposedly it was cultured. Well, but within a period of 12 hours, a team at the University of Sydney, they took that information and they turned it around very fast and they published the genetic sequence. So all researchers throughout the world were able to start doing some work on it. Then we had some Chinese authorities. They actually sequenced another 5 of the viral genome. And that gives us a good idea of where we stand. So it seems that this 2019 novel coronavirus bears a lot of similarity to the SARS virus, more than 85% similar. Appears to use the same ACE2 receptor. Seems to have highly conserved gene, except there's a lot of variation on those spike proteins. Remember the corona part that lets it attach? Well, now we have at least 8 different genomic sequences. And it shows that the genomic sequences of this virus, the 2019 novel coronavirus, are basically identical with each other. And what does that mean? That means that it's a new virus because there's a certain amount of genetic variability. The longer the virus has been around, the more different it gets from its brothers and sisters. So person-to-person spread, yes, there's absolutely person-to-person spread. But we still think that most of the people who pass the virus on are symptomatic. We don't think that asymptomatic spread is a significant issue. How likely are you to spread it? Well, if you look at measles, if one person has the measles, the likelihood of that person spreading it is, well, going to spread it to somewhere between 12 and 16 other individuals who are non-vaccinated and who are not immune to the measles virus. On the other hand, with the flu, going to spread it to just 1.3 other individuals. So it's not really highly contagious in comparison to the measles. Where does the 2019 coronavirus? Well, that comes in relatively low. It's about the same as AIDS or even a little bit less. Centers for Disease Control, again, says not contagious before symptoms occur. So what should you do? You should wash your hands a lot, preferably with soap and water. Avoid close contact with anybody who has respiratory symptoms. Fortunately, we know that these epidemics have a tendency to begin, for the most part, like the flu or like the SARS or like this 2019 novel coronavirus, in certain live animal Chinese markets where animals are held in close quarters. We're talking about the palm civets, of course, and the otters and the pangolins and the chickens and the fish and the turtles, kept in close proximity, unhygienic circumstances. Well, fortunately, the government closed them down as of January 1st, 2020. They didn't learn the lesson from SARS, but now they've gone and they banned the sale and the transport of wild animals. So restaurants, e-commerce sites, all gone. Well, in China, the epidemic seems to center in Wuhan City, which is kind of like the Chicago of China. It's a city of about 11 million people. And the government performed a public health experiment on a scale that was unseen anywhere else in the world. What they did is quarantine the whole city. Now they have a difficult time providing enough food and medical care. And it's probably too late because about 5 million people left the city before the travel restriction was put in place. Why did they leave the city? Because of the Lunar New Year. And during the Lunar New Year, hundreds of millions of people travel. And they also, the government, also quarantine the whole province. The province has 51 million people. So are quarantines likely to work? Well, we're going to see. But the important point is that they don't have enough food. They don't have enough respirators. They don't have enough doctors. They don't even have enough masks. And now that the city's quarantined, the price of the food that is available is increasing. So is quarantine a good idea? Can't really say. We'll find out. But they've closed Disneyland in Shanghai and Hong Kong. They've closed sections of the Great Wall. Movie theaters and cafes and bars are closed. The ladies' PGA, they've canceled tournaments. The Hong Kong Marathon is closed. The airlines aren't flying in to China. They've canceled tours and closed offices. People are told to stay off the street. The casinos in Macau are closed. They're shutting down the air and the rail and the roads. So that means the hotels and the restaurants and the retail and the tourism is suffering. And not only in China are they suffering, but Chinese factories send out components and send out final products to the rest of the world. Once upon a time, China provided only about 4% of the world's economic output. Now it's up to over 16%. And we're cutting that off. So what's likely to happen? Well, likely in some of the other areas of the world where they had quarantines, where they had major rioting. Well, in China, if people aren't going to work, people aren't getting paid, people owe money to banks, and now banks are starting to foreclose. and people aren't able to buy the food that now costs much more money. And you've heard about the passenger ships that are now under quarantine and out floating in the ocean. One, the Diamond Princess, overnight it seemed they went from 60 infected individuals to 135 infected individuals. And the people are kept in quarantine now, but 10 crew members who live and work side by side are also infected. According to the Japanese government, well, everything is okay, they're on target, nobody got infected on the boat. Again, we'll see. And there's a history that the Chinese government tends to suppress the information. So we don't really know how bad the epidemic in China is. So the whistleblower doctor, who happened to be an ophthalmologist, who reported that he was seeing some problems and they should close down the emergency room, well, he was severely reprimanded by the Chinese government and had to write a letter of apology. He died because he caught the virus. And we have reports of the Chinese government suppressing other individuals and news agencies from reporting on the virus. So we don't exactly know what the status is there. But we do know that the World Health Organization on January 25th said it's not a global health emergency, but they changed their mind 5 days later on January 30th and said, oh, it is an international public health emergency. So we're going to restrict travel and we're going to do all sorts of other things. Well, if you get the virus, how do you treat it? Most people do not require intensive care, but some are going to. Some are going to need some ventilation. Some are going to need some circulatory support and support for the kidney and the liver and the brain. We have some medicines that have been tested, but not really proven to be effective yet. We have always, with all conditions viral, we have ribavirin, we have interferon, we have hyperimmune globulin, we have some immune modulators that are used to treat AIDS, the lopinavir and the ritonavir, and then we have the remdesivir, and all of those can be tried, but they're not made in quantities sufficient for all of the people who seem to be infected, especially in China. But fortunately, the whole concept of coming up with a vaccine that started with the SARS epidemic seems to be going along quite nicely. In SARS, it took 20 months to get to a phase 1 vaccine. With the Zika virus, it took about 6 months. Now it's down to about 3 months. So scientists working at the National Institutes of Health and Moderna Therapeutics and J&J and Inovia Pharmaceuticals and people working in Australia are trying to come up with a vaccine. And the vaccine can work in several ways. It can block those spikes so that they can't attach to the cells, and it can also block the ability of the virus to replicate. So sounds like it ought to be a relatively straightforward kind of a vaccine to develop. To give you an idea of the number of people who travel from China to surrounding areas just in a 3-month period in 2019, it seemed that over 1 million people went from China to Taipei, more than 1 million from China to Bangkok, more than 1 million from China to Tokyo, more than 1 million from China to Seoul, about 750,000 to Singapore. By comparison, only about 200,000 went to Los Angeles, another 200,000 to New York City and to San Francisco. So the world economy might be in for a little bit of a shock because of the problems that they're having in China, the restriction of travel. After all, China is the 5th largest source of foreign tourism to the United States, ranking just behind Canada and Mexico and the United Kingdom and Japan. And if we look at New York City, 2nd largest contingent of folks who visit are Chinese. Good news is that seemingly some of the social media has at least stopped allowing fake cures to be advertised. They're cutting down on misinformation and directing people who search for information to go to legitimate sites. But with all of this, how many cases have there been? There certainly seems to be international panic. But so far, there have only been reported fewer than 45,000 cases as of February 10, 2020. 6,000 of those cases are severe. Here in the United States, 12 cases reported. Just 12 cases reported. In China, the doctors are overworked, the medical facilities underfunded. Doctors are seeing 200 patients a day. Government's opened several new hospitals, but they're sort of prefab facilities. And they don't even have masks. Masks are in short supply. Now, many areas throughout the world have gone to mandatory temperature checks at clinics, at airports, at bus and rail terminals, and malls, and supermarkets. Death toll so far, again, as of February 10, 2020, it's 910. That surpassed SARS, 774, surpassed MERS, 858. We've had the first death of an American. He happened to die in the Jinyintan Hospital in Wuhan City. Another death of a Japanese individual. Hong Kong. Also death in the Philippines of non-Chinese nationals. Now, making matters worse, it's getting to be the flu season. So the flu season in southern China is going to be from March to June. They have some cases throughout the year. They have a little peak in the summertime. In Beijing, in northern China, seems October through March is their flu season, with the peak being January and February. So now we're going to have the flu season on top of the coronavirus season. Well, talk about the flu. If you're going to worry about anything, worry about the flu. In 2019, 2020, the flu season, so far, there have been somewhere between 22 million and 31 million cases of flu just here in the United States. And the flu has been responsible for somewhere between 200,000 and 370,000 hospitalizations in the United States. And the flu has killed so far in the United States somewhere between 12,000 and 30,000 people this season. In a bad flu season, the number can get up to 65,000 individuals. And by the way, we have a vaccine, and by the way, fewer than 50% of the people get the vaccine. So that's the story of coronavirus. Been around for a long time, mostly as a cause of the common cold, but now all of a sudden we have this 2019 novel coronavirus as of December of 2019. It's long expected by the experts, and it's probably not going to be the last of the coronaviruses that causes problems, because we have lots of bats and lots of viruses and lots of potential for recombination and lots of animals to give it to so they can spread it to us. But so far, when we look at the coronaviruses, the major ones, well, the SARS virus disappeared after about 9 months. The MERS virus, even though it's been around for 5 years, hasn't infected 2,500 individuals. So now we're panicking about the new coronavirus. But just remember, most of the people who were infected have a mild infection. They are not severely infected. And it appears that relatively close contacts necessary to spread the virus. And yes, person-to-person spread does indeed occur. It almost always occurs from people who are ill. And remember, it targets the lower airways, not the upper airways. So when you see a person who has a runny nose and who has the symptoms of the common cold or the flu, chances are that person does not have the novel coronavirus. But remember, wash your hands, and don't forget, protect your eyes too. Wear your eyeglasses. They help protect your eyes. And remember, as of mid-February 2020, in spite of everything, we only have 12 confirmed cases here in the United States. But remember, we've had millions of cases of the flu and more than 10,000 deaths from the flu. So put things in proper perspective. We'll have more information, by the way, as the situation warrants. Anyway, thanks for watching. If you enjoyed the show, please tell a friend and consider subscribing so that you'll be notified when we post new videos. I appreciate your interest. I'm Dr. Ken Landau.